Hello and welcome. My name is Prabjot Singh and today I will be discussing about the thorax wall topographic anatomy. To begin with, let's talk about the chest. So the chest is the upper part of the human trunk which consists of thoracic skeleton including sternum, ribs, thoracic vertebrae and clavicles along with soft tissues coating it, and it is called cavitas thoracis in Latin. The limits of the chest are as follows. Superiorly, the chest goes from the jugular notch along the sternoclavicular joint and the clavicles up to the acromioclavicular joint, from where the straight lines are constructed to the spinal process of the seventh cervical vertebra. Inferiorly, the limits are drawn from the base of the xiphoid process along the edges of the costal arches to the 10th pair of ribs, and further through the ends of the 11th, 12th pair of the ribs to the spinal process of the 12th thoracic vertebrae. Now, the thoracic cavity is limited by some structures. So, the thoracic cavity consists of thoracic pairs of spinal column, 12 parts pairs of ribs, and the sternum. The superior thoracic aperture is formed by the superior border of jugular notch of sternum, first ribs, and the shaft of the first thoracic vertebrae. Through the superior aperture, the right and the left cervical pleura and the apexes of the lungs run out into the supraclavicular region. Also, the trachea, the esophagus, the vessels, and the nerve of the thoracic cavity passes through it along with the facial cellular spaces. Inferiorly, the thorax is closed by the diaphragm and is separated from the abdominal cavity. The esophagus, the vessels, and the nerve pass through the diaphragmatic aperture. The layers of the thoracic cavities are as follows. Superiorly, it is skin. On the anterior and the lateral thoracic walls, it is thin and movable except for the area of the sternum and the spinal processes. It is easy to take in folds. In the area of the sternum, the skin has sebaceous glands, and the posterior wall, the skin is thicker and less movable. In the subcutaneous adipose tissue, superficial vessels and nerves run out. One of these nerves arise from the level of the umbilicus and is considerably very long. In the subcutaneous adipose tissue, the cutaneous branch of the anterior and posterior branches of the first to ninth thoracic cerebrospinal nerves split off. In the upper part of the skin, it is innervated by the rami of the supraclavicular nerve. The superior fascia is thicker posteriorly, and while interiorly it looks like a thin connective lamina that is not always identified. Under the clavicle, the superficial fascia invests fascicles of platysma that arise from the spot. Below, the superficial fascia makes connective capsules for the mammary gland. So the mammary gland are one of the most important structures which is present on the thoracic cavity, outside the thoracic cavity. So the mammary gland is situated in the subcutaneous layer of the thoracic cage. It takes the space between the margin of the sternum and the anterior axillary line at the level of the third to fifth, sixth, or seventh ribs, forward of the musculus pectoralis major and partially of musculus serratus anterior, coated with the fascia propria. The form and the size of the gland in women depend on their sexual development and individual characteristics. The skin of the mammary gland is thin and slightly movable in relation to the gland. It moves only with the gland itself. The subcutaneous adipose tissue is permeated with collective bridles connecting the skin with the gland capsule. It is due to them that the skin is lightly movable over the gland. The mammary gland is invested in the capsule formed by the split of the superficial fascia. Between the superior borders of the gland and the clavicle, the fascia is thickened. There are 1 to 3 ligaments in it suspending the mammary gland. It is called the Cooper's gland. Now let's talk about the thoracic fascia. So the thoracic fascia is like in any other region, covers the muscles and the chest wall. Near the pectoralis major muscle, it is called fascia pectoralis and consists of two laminae, the superficial and the deep one, that forms the facial capsule for musculus pectoralis major and musculus pectoralis minor, and the borders the subpectoral intermuscular cellular space. Down and inwards from musculus pectoralis major, fascia thoracica passes onto the tendomuscular fascicles of musculus serratus anterior and external oblique muscles of the abdomen. On the posterior thoracic wall, it consists of superficial lamina that forms the fascial capsules for the inferior portion of trapezius and latissimus dorsi muscles. So the topographic anatomy of the intercostal spaces. In between the ribs, there are external and internal intercostal muscles, the cellular tissue and neurovascular fascicles. The external intercostal muscles go from the inferior border of the rib obliquely from the top down and forward to the superior border of the subjacent rib. Deeper, there are internal intercostal muscles, the fascicles of which go in the opposite direction from below up and backwards. The Quite frequently, muscular bundles split from the internal intercostal muscles and insert along the internal edges of the sulcus costae, which is musculi intercostalis intimi. Between musculi intercostalis minimi and interni, there are thin layers of cellular tissue through which an intercostal neurovascular fascicle or an intercostal nerve may pass. The space between the adjacent ribs, bordered from outside and inside by corresponding intercostal muscles, are called intercostal space. The intercostal vessels and nerves are situated in this space. First goes the vein, then the artery, and then still deeper the nerve, as we can see in the picture. The intercostal fascicle in the area between the paravertebral and the mid-axillary lines run in the sulcus of the inferior border of the subjacent rib.